Hi, everyone. Welcome back. I am so grateful that Dr. Alyssa Hellman has agreed to join me today in a conversation on our podcast. Dr. Hellman, thank you so much for saying yes.
Thanks for having me.
So, you're actually joining us from Israel, right?
I am, yes.
Very late at night.
Yes. Late at night, but not too late that
Not
it's still
terrible.
okay. Yes.
Okay, so I feel like I have met you really kind of officially or on Instagram. Like I saw you beginning to put out content beyond the creative content. There was a lot of education that I was so impressed by and so pleased that this good quality medical education was kind of hitting the community. Maybe tell us a little bit about yourself, and then I want to hear more about how you came up with this idea of putting education out into the world from an OBGYN perspective.
Yeah, for sure. I have been an OBGYN for a while. I don't know, including residency. I guess we're at 17, 18 years, something like that. It's too much math for me this late at night. And Originally started working and did all my training out in New York. Did move back to Milwaukee where I'm from and had like a generalist OBGYN, pretty like nice fulfilling career there. Doing all the OB and the GYN stuff. It's not a huge community, but like Jewish community, I would say. But, here and there, I would get like questions about, how can I'm getting married or my daughter's getting married, or like, how do I help, like, control the period around the timing of the wedding. And then like it kind of morphed into like, seeing people at shul at Kiddush and getting like, oh, hey, can I just ask you something? Hey, can I just ask you something? And I'm like, yeah, I don't mind answering, but like, there's like a time and place, I think. And so that kind of morphed into like, whoa, like my community like needs a lot of help here. And there's just something missing that they didn't get in their education growing up and even getting married and getting pregnant and being a woman, right? And going through all the process. You just kind of like float along in it and learn what you need to know pertinent to you and your situation, whatever it is. And like there has to be a little bit more of like general women's health education in our Jewish community. Um, and and so I kind of in all of that put together a telehealth practice that allowed me to do really one-on-one consultations like, hey, you know what, like I don't want to just throw a prescription at you and like tell you when to take it. I want you to understand what's going on, what your options are, why you're taking these, what side effects, what benefits, like the whole package. And then like as that kind of morphed, I kind of popped onto Instagram and was like, hey, like aside from also doing one-on-ones, like we got to get a little bit of this information out there and kind of supplement or make something available to really allow women, growing up and going through all the phases of their life, really try to like understand themselves and what they're going through, what's happening to their bodies and why, and what ways do we have to help you feel better if you're not feeling great, or help you make choices in your life with your family planning that are right for you, and not being just told what to do. I think that a lot of, not in a bad way, but a lot of our religious kind of the way we live our religious life is like, okay, what's the halacha here? What do we do here? What do we do here? Tell me what to do and I'll gladly do it. And a lot of that kind of fed into, I saw the similarity and kind of fed into how we also view our medical care. And like, no, this is one aspect where like you don't always need to be told what to do. You can be presented the options and you actually get to pick sometimes. Like embrace that, enjoy it. And but to do that, it does take responsibility of allowing yourself to like have that education and receiving it and using it. So I guess to sum it up, that was a
I
long
love it.
summary.
No,
But
I
yeah,
love it. You just gave
yeah,
me a whole list of questions that I didn't even think I was going to be asking, but I love that. And I think, that idea of like I actually think about maybe we could start with this idea of like who are the gatekeepers, right? If we think about the information, in early puberty years or in puberty, much of that information is relayed hopefully to be with a parent, right? From a parent,
yeah.
hopefully from a mother if it's a girl. And if that, like, who are the future gatekeepers? I think just go straight to college teachers, and beyond that, there's nobody else. And I'm wondering about like if we were looking at where there are gaps in how this information is disseminated, like where are the holes? Like it sounds like you're filling a very important one professionally. Where else would we be getting this information from, right?
Yeah, there's a lot of holes. And I also think that there's a lot of individual experience too. So, and that's in every step of the way. So you can have a mom who's like, I'm going to tell my daughter everything and give her all the proper words, and she's really going to understand this, and she's going to like see the beauty in her body, and I'm not going to make her feel embarrassed, and we're not going to hide, beat around the bush and use words that she gets confused by. Or you could have a mom who's like, oh my God, I don't know what to say. Here's some pads, and like here's a
Hope
book.
for the best.
Right.
Exactly.
And you could then have be in SEM, and you could be talking with your friends. And because you didn't get good education, or because you did get good education, you're hearing all these different things. And there's like that little social aspect of it where like you trust your friends with everything else. So why wouldn't I trust them with the information they're giving to me? And I could be totally wrong because who knows where they're coming from. Then you get to probably like the college teacher aspect. There's a massive range of college teachers, and I do feel like the general trends overall is the training is becoming wonderful and very comprehensive. And what I feel like in general, college teachers do want to also have a good medical background because they know they're going to get a lot of questions about that. But there's a huge range there of like, here's the halacha, here's the hashkafa of marriage, and like, oh, go take that kala pill. Versus, no, I'm going to go over every little detail of your anatomy. We're going to talk about pleasure. We're going to talk about sex. We're going to talk about your cycles, talk about fertility. And I'm not, caveat, I'm not saying that 100% is the college teacher's role, but there are some that are a lot more comprehensive. So there's again a huge range. And what do you get, right? It's hard to know
Right.
sometimes. So hey,
Right.
that's a good spot to do your research in and ask around for like college teachers and the experience that people get. And then we have usually the next step would be the doctor, right? Because like you're probably going to be pregnant if everything goes well within the next few years after marriage, and enter now into a sexual relationship, and just have to be a little bit more aware of what's going on physically. And I think there's also massive holes in like the doctor experience as well. I mean, we have people who like feel like they get really good education and they have this great relationship with their doctor, and we have people who are like, wait, what just happened after walking out of the exam room? Like, I don't feel like any of my questions were answered, and I feel stupider now. And it's it kind of takes a little bit of personal responsibility of like, yes, all of those parts, the people who are doing the education definitely have room for improvement, but you also need to be aware of what you think you're lacking, what doesn't feel right. Why do I feel uncomfortable with this? Why do I feel like I just don't know, like I just don't have a good handle on something, and then ask it, seek it out, research it,
Right.
find it, like find the right
Right.
people. So there can be holes all along the way, and there can be like great opportunities for learning all along the way.
Right. And yet one of the things that I know we're challenged with in most countries at nowadays is the limitation of how many minutes I get to spend with my provider.
Oh, for
Right. Like,
sure. Yeah.
I'm a pretty empowered person, but when I walk into that room, I always have a post-it note with me. I'm like, don't
Yeah,
forget to ask about this question and like check my list, make sure that I've covered
for
everything
sure.
because when you're in there, like you said, you kind of lose your mind a little bit, especially naked,
Right.
on the table. It's really not
Right.
like a moment when you're fully in your body. I want to come back to one of the questions I have about the college teacher perspective in terms of like the dissemination of information. I imagine you will agree with me that there's so much risk there in almost like non-data driven information, right? Where you can educate a college training, a college teacher, a community of people about certain issues, but very often it could be interpreted a certain way. And we really don't have any kind of like kind of quality control, I guess you could say, that the information that's then being shared to others isn't being handed out exactly as you started this conversation of just do this and it's fine versus these are
Right.
the options. This is the converse. Like, I guess, I'm wondering what your experience has been I'm sure you've done a lot of educating of the college teachers, for those not familiar with that term, the education that we give to young women before they get married. A kala is a bride. But a lot of knowledge and education shows up there. But I think also a lot of it probably is pretty quickly forgotten the minute you walk out of the room because it's a lot of information. And I
Right.
see like there's limits to the relationship, I guess you
Yeah,
would say.
for sure. And remember, like, anything I'm talking to a college teacher about, like for education for them to then go teach that to their colleagues. Remember, like I've been in training for a long time. Like this is my field, it's my profession. I have these conversations with women like I don't know, 20, 30 times a day. Like I don't expect the training that I have being a prescriber or being like in this field to be like for that a college teacher to like say it over in the same way or like understand it in the same way. Like I don't have that expectation. Um, and one point I kind of wanted to bring up that I thought of when you were kind of asking that question is yes, people do come into like when they're educating and when they're talking about a topic, they definitely come in with their own biases, with their own experiences. And we see that, I mean, on social media, especially the explosion of like, I took the birth control pill, I hated it. You should
Don't
never
do
go
it.
on it.
Oh, thank you for
Like
bringing it up.
this
Yes.
big, huge, like, well, because I felt this way, and that was my experience. Of course, everyone needs to also do what I do. And
Mhm.
the big piece of education here, and anyone who's talking to women about what their options are, just needs to be very neutral and very like these are your choices. This is why you may want to choose this one over this one based on what your periods are like or what your family planning, needs are. But these are all still your options. You get to choose what's right for you. It may not be what I would choose for myself, but we have different lives. So the importance of not putting your own opinions in, if there are trends, if they're like, look, in general, this specific progestin or this specific birth control or this specific something isn't always like I've generally seen a trend where colleges don't do well on this or colleges do great on this, right? As from the college teacher's perspective. I think that it's okay to discuss that trend, but to very specifically lead someone one way or the other or away from something that may be helpful versus not just based on personal experience, I think that's where the danger is, right? Like
Yeah.
just be the educator and trust women enough that they can make the choices that are good for them because they know
I
their own lives the best.
Yeah. And I love that, especially because I think, I was having a conversation just this morning with a group of providers about this idea of like the conversation around birth control and its impact on hormonal influence, and the conversation about like, if we can have some of those really nuanced conversations, but often that just gets translated into this medication means it's going to give you anxiety, exactly what you were just describing, what's going to get yelled out on Instagram. Unfortunately, recently we've had a big influx of that.
Yeah.
And there just gets to be this like takeaway, like these bite-sized takeaways from the experiences that people are getting online versus from data-driven information, like from their physicians who can describe it and explain it a little bit better. um
Right.
yeah.
Yeah, and even like going further than that, I'll be honest with you, and I recognize this as a problem in my profession is that sometimes there isn't the time, right? Like you were saying, like there isn't a lot of time to fully go over every little tiny piece of education with every option. But there's also to understand that these conversations are very nuanced to your life. And it's not, you can't get an answer from a 5-second soundbite reel piece of information, tips that are built to get followers and likes and watchers, right? Views, whatever they're called. And it's these decisions, they're nuanced, tailored to you. And that's why also when you go into a doctor and you're like, look, I may have like 13 minutes or 9 minutes or whatever to discuss all of this. Let me educate myself a little bit so that my questions are focused. And it's not like, what birth control should I go on? It's, I looked into this and based on my other medical conditions, do you think this is right for me? Or would it not be right for me? Or like, these are my family planning needs, do you think that this method that I looked into would be appropriate? Like very like more directed questions rather than open-ended general ones, because that's when you may not get all the detail you need because you didn't ask detailed questions.
Mhm.
And so that's, I don't know if that answered your question. If I
No,
just went
that's a
on a
great
tangent,
point. No, it's an
but
excellent point.
yes,
It's that idea of like, on one hand, we're told don't come in as like, don't come in as Dr. Google, that you know everything because you've read it online. But what you're giving me is a different perspective of saying, come in informed. So is it this versus this, or this is my medical history, and based on my medical history, is this medication or that medication of better, higher value?
Right.
I think we in some ways have very often are surrendering all the information and knowledge to our medical guides or physicians. I feel very strongly about like trusting our medical providers.
Yeah,
But
for
what
sure.
you're offering is this idea of like, but when you come in and you offer me, this is what I know, this is where my question is, you're actually acting more as a partner with your physician.
For sure, for sure. Yeah, and that's exactly what it should be. It shouldn't be like I'm telling you what to be on because I think
Right.
this is right for you. It should be like, oh yeah, that totally makes sense. These are your goals. This is what you want to achieve. I'll let you know based on my like medical expertise what I think really fits all of these and why I think these would be good for you. But you know what? If you don't feel comfortable with that, here's option number two and three and four,
Right.
right? And yeah, a partnership, and I think people are so much happier with their medical care. And from my selfish perspective, it's such a much more enjoyable encounter with a
Sure.
patient to feel
Sure.
like we're having a conversation as opposed to me telling you just what to do.
Absolutely. So when we move into like once we move into the reproductive year, so we mentioned a little bit about like where our kids are getting educated, where we probably got our education. I think I got mine on the third grade on the playground, and then
Right.
different kinds of education shows up in seminaries for sure. Overnight camps,
Overnight.
I think, are great resources for education.
Yep.
Not usually good ones, but now hopefully when now we're adulting, right? And where are the holes that you feel exist in how women like where are the holes in knowledge that you wish people understood in their pregnancy and even we can get into post-pregnancy years or the reproductive years that you just wish that you could be like, guys, listen, pay attention to this information. Like I wish somebody could teach you this information. And I'm not speaking specific to this pill versus that pill, but in general, like when it comes to women's health, where are the gaps in knowledge and experience that we don't necessarily have a direct mechanism to get to the audiences?
So that's a good question. My initial reaction to that question, like the initial thing I wanted to say was a little like the opposite of sometimes with pregnancy, at least, we have too much information. We are bogging people down with so much stress of you have to do this and you have to do this and you have to do this and you have to eat like this and you can't eat like this and you have to exercise and you can't do this workout and you know it's so overwhelming and sometimes it's just an important perspective to gain going through all these years is pregnancy is a normal physiologic process. Most of the time it works out. I know a lot of time your population that you see often doesn't, but most of the time things ends up okay. Um, your body is doesn't always know what to do, right? I hate looking at the body
Right.
as like the
Right.
extra brain, but there is a normal process to all of this. And sometimes we have to take a step back and be like, am I eating healthy? Yeah. Okay. Am I like do I run a healthy life? Yeah. Like, am I taking any medications that could harm my baby or not? No. Okay, great. I'm okay. Like take a step back and don't worry that you're not doing something good for your pregnancy. So it's almost like a little bit like I think we need to uneducate or kind of take it like lose some of the fluff that doesn't matter that creates anxiety, basically. Um, I think doctors are pretty good at doing that. I think that's like a good part because I'm gonna if you see me worried and upset in the office, that's when you should be worried and upset. If you see me calm and relaxed, you should be calm and relaxed, right? I'm responsible for you, right? So kind of understanding that gaining that trust, like with the person who's taking care of you and your unborn child in pregnancy, and feeling like you really can ask them your questions, so you don't feel like you have to always
Mm-hmm.
search out. I think specific areas that may be harder in a time crunch exam situation like medical appointment visit, especially in pregnancy, has to do a lot with labor and delivery. I think usually people kind of trust their doctors to get them through a pregnancy because it's just like coming to appointments. But the process of labor and delivery is usually like it's unknown, right? None of us know what's going to happen. And feeling like anything in the world could happen, but I want it to happen this specific way. How do I get that? And the attitudes you have towards your medical team of are we partners? Am I fighting you? What are all the things that could happen in a hospital? I think there it's really helpful to have outside classes by either like a doula or a lot of times the hospitals offer that you're going to deliver at offer just information classes, not necessarily like birth classes, but just information where you may not be able to get all of that 2 hours or 4 hours or however many hours the classes are with your doctor, for you to I have a better understanding so you feel more comfortable of the whole process of labor and delivery and what would happen.
Mm,
I really like do offering like I really like when people do it at the hospital because they're usually done by people and like specifically nurses who have worked with your doctors, and so they have that kind of like insider information of what you may experience, with your team that they work with all the time.
mm,
So that's just make sure that you feel comfortable with the person who's teaching you. I've had people who are like, they started bashing epidurals on me, and I like really wanted an epidural, but now I feel really guilty about getting an epidural. So if you feel uncomfortable, you can leave. You can find a new class. It's not,
right.
you don't feel committed to it. And that's also great for you to recognize your own red flags and green flags. Like if you feel really good with someone or if you feel really uncomfortable and like off, make a
Mm.
change. That's definitely okay too.
I love what you're also saying because to me, while you didn't use this terminology, one of the things that I'm hearing you not so explicitly say is where are you getting your information from? And I think that especially during pregnancy, there's a lot of information coming from social media spaces. All right, it's
Yeah,
coming from it may be influencers, but it might just be very valid people, but who are putting a lot of information out there, and that could just be very overwhelming when there's so much newness that's happening, especially for a first pregnancy or first,
right.
hopefully first live birth. That's the identity of the work that I do, right? But that idea
Exactly.
of like that first pregnancy, that everything is new, maybe also seeking guidance from your medical provider. Where should I be getting this information from? If I could follow one person, if I could read one book, if I could attend one class, this is your medical team says these are the good guys. Like these are the ones that I align with,
Yeah,
medically, professionally, like choosing someone who is the disseminator of information that's authentic, real, evidence-based, hopefully, and
right.
hopefully, trauma
And
informed.
that's
Yeah.
look, I love social media. I'm on social media, right? You know that. I think there's so much potential for such great information to be spread, but then there's also the opposite. And I
Yeah.
think the important piece in consuming social media information is understanding who you're getting your information from. And just because you were pregnant doesn't mean you are the expert on pregnancy, right?
Right.
Um, if you've delivered 10,000 babies in your life, yeah, you're probably for a pretty good source for having questions about labor and delivery, right?
Right.
Um, so, it's important to click on a profile, look at if they have a website, look at their website. What is their education? What is their training? Have they published, right?
Yeah.
Where have they
Yeah.
published? Watch some of the videos and be like, am I getting like data points? Do I trust this person? What are they using to back up what they're saying? Is it like hey, I saw this one time and this is what you should do versus like here's the
Yeah.
data, right? Like there's ways to kind of know what's red flag information and what's not.
Right. Right.
And people can make beautiful picture perfect accounts where everything looks very professional and it sounds like they're giving information that like, oh, okay, and it's we don't want you to get taken advantage of, right?
Right.
And there are plenty of wonderful, amazing accounts that I follow that I
Yeah.
actually learn from also, right?
Sure.
And like especially when I know we kind of want to transition into this, like my perimenopausal menopausal patients, like unfortunately, we didn't have tons of training. And I think that's coming out now. Like I
Yeah.
was in training, 15, 20 years ago. Like I didn't have great education on the menopausal piece. I'm learning also with you. And like as this, because that's kind of like the new thing now.
Sure.
And I have a bunch of accounts that I'm like, wow, I love that I'm being exposed to it because like I'm not in school right now. Like, how else am I
Right.
gonna learn this? Like I
Wait,
have
who are
my
your favorite? I want to
yeah,
know who your favorite ones are because I mean, that shows up on my feed, but do you remember some of the names of your favorite people that are doing menopause or
yes,
perimenopausal names?
menopause. I want to get their names right. I'm just
Okay,
like
we can
signing
bring
back
it
on.
up. We can
But
bring it
um,
up.
um, Mary Claire Haber is wonderful.
Yes.
And Jen Gunter is wonderful. Kelly Casperson is great.
Right.
Another one that I really like is Fasting MD. She's not specifically menopause, but like a internal medicine combined nutritionist that really kind of focuses on the nutrition, um, vitamin supplement aspect of it in a way that is refreshing about supplements because it's like, this is why they work, not, hey, take this and I'm selling you and I have like 50%
Correct.
off of my supplement,
Correct.
right?
Exactly.
It's like, I don't care where you buy it because I'm not selling it, but like, this is why this will help you at this phase of your life for this like
Right. Right.
physiologic reason. And I love that. I love when we can understand, like, I take a bunch of supplements. I can tell you why I take every single one, not just because like it's cute or it's trendy or like came in a nice little packet, right?
Right.
Um, and and I think that's those to name just a few, but I think that it's really important to understand why you do what you do with yourself, right?
Yeah.
Like,
Yeah.
why are you putting this medication in your body? What is the purpose for it? And how is it helping you? Is it not? Like, assess, like take a step back and assess and be like, what do I need? What does my body
hmm
need right now? You
hmm
know?
Can I ask you one question before we move fully into the perimenopause conversation? Like, what do we wish people would know about it? I want to ask you about one statement that you just made a few minutes ago about, I'm your doctor. If you see me worried, you should be worried. But other than that, I'm not worried. And I've heard this from patients before, meaning quoting physicians who are saying that. And it's interesting to me because sometimes while I understand that and I can trust that, for some people that I've interacted with, some of my clients in particular would say, like, she didn't hear me. Like she's not hearing
Mm,
how worried I am. And you're saying to
right.
her, you don't need to be worried. And they're saying, nobody's hearing what I'm saying. Right. And now some of
Right.
this, that's kind of maybe there's the kind of the crossover of anxiety of like, actually, there really isn't anything to be particularly worried about, but you're feeling very anxious and we need to address this from a mental health perspective. But I'm just wondering about like the tension between I need you to hear my fear versus the physician saying, we don't need to be fearful, right? I'm just wondering, I don't have a
Yeah.
question per se, but like it's sticking on me. That wording is sticking with me because I'm hearing sometimes the fallout of that language where patients are saying, like, I don't feel heard or seen or supported. I get it, but what do you think?
Yeah. I think the connecting piece to the she's not hearing me. I'm really scared of all this. Maybe because I have no clue what's flying. Maybe because I've had past poor obstetrical experiences, with either with other doctors or like, poor obstetrical outcomes. And connecting the piece of like, I got you, like you're fine, don't worry. From my perspective, is the communication, right?
Yeah.
It's tell me, I may not know. You may be walking in like you look all cute, and I ask you how you are, and you're like, I'm great, everything's fine. How do I know that you're not fine if you don't tell me that you're fine? I mean, unless you start like, sometimes I'll have like a postpartum mom who walks in and I'm like, how are you? She's like, I'm fine. And 2 seconds later, she's
Starts to
bawling.
cry.
Okay, she's
Right.
not fine. But
Right.
like, would I know that if you
Right.
didn't start crying? I don't know.
Let me clarify. I want to say
Yeah,
when the client says to you, like, I'm really worried because I'm experiencing pelvic pain. Like there's a lot of pressure. And you keep
right,
and the physician says, but that's kind of normal towards the end of the pregnancy. I'm really not worried. And the client or patient keeps going back, but I'm really uncomfortable. I'm really like this is and almost like
right,
normalizing a lot of the experience of pregnancy, which may actually be normal. But the
right,
patient is experiencing it as you're not hearing me. I'm really uncomfortable.
right.
But I think you're speaking to the communication piece, right?
Right. So then that's why the communication is important. And there's also like, and I take this from, not that I'm the best parent in the world, but I take this from like what I've like parenting lessons of like validate
Yeah.
and explain. Like, I hear that you're really uncomfortable. Pregnancy at the end sucks. It's really uncomfortable and it is not fun. So you're having pain like in your pelvis or at your pubic symphysis or in your hips and in your back. That's normal. But this is what I would be worried about if it started. So if you're like bent over and you literally can't take a step, if you have any bleeding with your pain, if you are having like shooting pains down your leg where you are like cannot walk, right? Like if you are starting to have what you think may be contractions, right? If you this is what I can tolerate because I know it's normal and I know it's uncomfortable for you. And these are a few things you may be able to do to actually relieve that pain or take care of this problem. But other than that, I can't do much.
Yeah.
But
Yeah.
if these things start to happen, I need to know about that because that's when I get concerned because I know that medically okay, there really may be a problem here that we need to
Right.
solve in a different way. So I can't always fix your problems, but I can let you know the little things we may be able to do to alleviate them. You can try them. They may or may not work. But then also like when do I get worried? And that's why I care. People come through all the time, like so short of breath. I have palpitations. Like that sounds really serious, right? Like I can't breathe well. I have my heart's
Sure.
racing all the time. Yeah, that's also normal in pregnancy. And like I hear that like flippancy of like, oh, it's normal, it's normal, it's normal. And I feel like I say that a lot, but it's like, but you know what's not normal? It's not normal if you pass out. It's not normal if you have chest pain. It's not normal if you like go up, a few stairs and you literally can't breathe. So like
Right.
validate that like this could be normal, but also maybe it's the beginning of something not normal. And I want you to know what to look out for. So it's like
Right.
I can't take away the normalness, but I can tell you what if this progresses, what's not normal so that you can
Right.
come back to me and be like, hey, remember that pain that you were talking about?
Right.
Now I have all those serious symptoms that you were talking about. Like, oh, okay, great. Like now we really need to like do this test or that test, right?
Right.
So it is about like you tell me what's bothering you and why, and then I tell you why I think it's fine, but also when it will not become fine. It's
Right.
communication on both
Right.
ends.
Right.
Right.
And I think that you're
And I
right
think
though to also like address that from the perspective of also that validation. I think more and more a patient is trusting of their physician and also really does need somebody to say to them like, I know this is like you just said, it sucks, right? Like it's
yeah,
really hard. And I think sometimes that message doesn't get heard as loudly as the you don't have to worry about it message. And yet
right.
and that's not on
I
the
agree.
responsibility of the physician, but it is, I think, part of that dynamic of I need somebody to like let me be really upset at how hard the rest of this pregnancy is going to be. And sometimes I think that that expectation that the physician can hold that for you is unwarranted because it really belongs in the therapist's office or
Yeah,
among your other pregnant friends who can be like, oh, it's horrible and I feel so bad and I feel so sick and or I'm just so uncomfortable.
right,
Like
right,
physicians are there for the medical component of it
right,
versus the
right.
validation.
And I
So
think and that also feeds a little back into the social media consumption of when we see all our influencers that we like to watch and then they have their babies and then everything looks so picture perfect and they get all these gifts and all the unboxing and my baby like there's no poop anywhere, right? Like everything looks perfect. Um and you're like I'm a wreck. Like
yeah,
there's poop stains all over, there's blood stains, there's milk stains. Like why am I like a mess? But like I'm supposed to be all like perfect and wonderful, right?
yeah,
And glorifying like all these gorgeous maternity shots and everything. You're just like, I just want this pregnancy to be done. And with people that you often see, probably like pregnancy sucks, but like, wait, I can't say that. I need to be so grateful that I am pregnant because like not
exactly.
everyone gets to
Yeah,
be. And there's so much emotion there,
yeah,
very much influenced by what we expose ourselves to and what we see and what is just like shoved in our faces. And so I
right.
think the awareness of like, I can be grateful that I am pregnant and or that I just had a beautiful baby, but I'm really uncomfortable right now and this is really hard. And just like being okay with that and not like you're not living on Instagram. You live in like your real life, right?
Yeah.
And really kind of being super aware of that.
I love it. And you are right. And you are right. And you are right. I think, I think I just want to give one shout out for one Instagram. Well, I mean, they also have blogs and things like that, but Scary Mommy is a wonderful
Yeah.
space to get some of the real life exposure to what pregnancy really and postpartum looks
Yeah.
like. I highly recommend that one.
And then I'll
Yeah,
give one more. Dr. Sterling,
please.
OBGYN. She was an OBGYN and then she kind of like just felt like she couldn't give her pregnant patients what she wanted to give them. And so she kind of like left clinical medicine and now basically like gives classes and you can like have a membership with her, but like helping relieve the mental stress of pregnancy and the
Really.
validating like this may not be so beautiful for you. It's okay to
Hmm.
have guilt. It's okay to be stressed. Like this is how we're gonna relieve that because we're going to talk about it and we're going to educate you on what you're stressed about and we're going to just validate that it's totally fine to hate pregnancy even though
I
you're
love it. I
happy with
love it.
the outcome.
I'm
Yeah,
gonna find her online.
yeah, yeah.
Let's finish off our conversation today, and moving us a little bit forward into the end of our reproductive years, and talking about post pregnancies, meaning perimenopause into menopause. And same question, what do you wish people understood? What do you wish they were asking about? What do you think people knew? What do you wish people knew about this period in our lives? And before I have you answer that question, I just have to give a shout out. I grew up in a generation where Oprah was on TV, right? And if I was lucky enough to, I used to go on rounds with my father in the hospital, and it would be on the summer, it would be at 4 o'clock, and I would like go from room to room watching Oprah with
Yeah.
him. He'd be like, I'm like, I'll stay here and finish Oprah. And I think that she, in many ways, has created a lot of like leadership. She's been a leader in conversations about things that nobody else was ready to talk about. I think she was one of the first women who ever disclosed her own personal child sexual abuse, and I see her in many ways like in leadership, and that she's doing this in menopause, which I
Yeah.
think is super cool because she's actually
It's great.
70, believe it or not. But she just put out
Doesn't
like a
look it.
huge
Yeah.
no, and she just put out a whole, and she's way past her menopause years, and yet
Right.
she's focusing in on these
She's still
issues.
menopausal. She's still
Yes,
menopausal. You're
yes.
menopausal forever once you are. Yeah.
That's true. That is true. And so just kind of like there she put out an excellent just one magazine on menopause, and I just think that like it really, I don't know if it's only her, but there are many that are beginning to open this conversation, and it could be my age and that's what's being fed to me on social media, but talk to me a bit
Same.
about where are right
Yeah.
now. Welcome to the party.
Yes, exactly. It is a
So
party.
it is a
Yes.
party. So let's talk about what do you wish people knew about their medical experience of perimenopause and menopause?
Yes. I have a lot of feelings and thoughts on it. Um, I'll bring up two of them at least. One is I think um understanding that just like you go through puberty at the beginning of your reproductive years, and it's a process, also understand that on the other side of that, it is the reverse process that is happening. And it's a huge change. Just like being 10 and being 20, you had to a lot change between age 10 and 20, right? So a lot's going to change between 40 and 50 or 30 and 40, right? There's going to be a big change that happens at the end of those years, just like there was at the beginning. And it's a normal process. So when it may not be a comfortable process, but it is a normal physiologic process, just like puberty is. And when again, social media piece, when we are being told this, my hormones aren't balanced, I need to balance them. Like I need to do whatever I can to make myself normal again, get myself regulated, get myself balanced. The perspective we have is something is wrong with me because I'm now perimenopausal and menopausal and my hormone levels are changing, and that is bad, right? Like that they shouldn't be off. They need to get back to normal. But actually, the offness is a normal process. It's the symptoms that you don't want. It's the symptoms of this slow decrease in our hormones. That is the normal process of perimenopause and menopause that we need to be aware of and address and not ignore and not say you don't get any treatment because this is normal. But the focus on trying to balance hormones, every OBGYN, it's a very triggering word to balance hormones. That's not really a thing, but to recognize that they are going down, that is normal. Your body's functioning how it should. But you know what? When your estrogen levels drop, it can be really uncomfortable. So, what are your symptoms? If they are vaginal dryness, if they're painful sex, if they're hot flashes, if they're headaches, if they're joint pain, if they're difficulty sleeping, if they're brain fog, if they're, irritability, if it's one of those, if it's all of those, what can I offer you as a treatment for your symptoms? Because I want you to live your best life, right? Like in this process. So I think just accepting the normalness of it, but not accepting the discomfort that comes with it. And hey, what can I do about that discomfort? Because I recognize that, hey, thank God I got to live this long. I'm going through this process, right?
Yeah.
And then on top of that, also recognizing that even though I may have a lot of physical discomforts and I may be like, whose body is this? And why did I feel like this happened overnight? That like my knees click and my hips click and like I can't fall asleep and like all of these things that may be happening to you that you're like, what is going on? Okay, we can treat that stuff or we can work on that stuff, but also understand that like you are becoming a different person. Your brain, which does have hormonal receptors, is totally changing. It's rewiring. It's this process that you have to also go through, not only physically, but mentally for the good. Like you may feel like your body is like kind of rebelling against
Decomposing.
itself. Yeah, that's a good word. You can tell we're both in this, right? But mentally, you also you're in a you most people are in a time of their lives where like maybe their kids aren't super little anymore and they have a little bit more time, or they can focus a little bit more on themselves, or they can be like, whoa, I can finally pay attention to me, and use that knowledge that like your brain is rewiring to become the person you're going to be for the rest of your life. You may be menopausal for the second half of your life. Like, own it, embrace it. Like, don't look at yourself as like, oh, I like reached my peak and now that's it. Like,
Mhm.
you're now able to do more, to think differently, to have different perspectives. Like this could be a really great time in your life too. We just need to make you comfortable physically, right? So just kind of like those are my two main perspectives that I personally have tried to embrace. But also I try to really talk about with my patients of like, yeah, I know this symptom sucks and this symptom sucks, and here are your options. We're gonna talk about what you want to do. Um, but you're gonna be fine. You're gonna do great, and we're gonna like get you through this, and you're gonna be happy. Like let's put a
Oh,
positive spin on this.
you really like took my breath away a bit because it felt like you were like giving this almost like as a directive of like change your attitude like in a really
Yeah,
positive way, and I haven't heard that perspective actually promoted very much at all. I've only heard the negative and only heard the oh, just getting ready for it and here it comes, and we're just gonna
right.
have to deal with it, and I love that perspective. It's such a healthier, emotionally healthy perspective, and I
Yeah,
obviously
and
want to.
I'm not
Yeah,
taking away the negative because I don't
sure,
want
no,
to
you
minimize
honored
that. I
it. Yeah,
recognize it, but I think reframing things and understanding it for what it is, right?
yeah, yeah.
Is that yeah, it doesn't have to be horrific. And if it is, we'll help you, but like you're gonna come out on the other side. You're gonna be okay.
Yeah. Oh, I love that. I guess I would ask you one more question. Well, let's leave that there because I feel like that's going to have to be another whole topic of conversation. We're going to have to talk about menopause. But
Yeah.
I do want to ask you if you were to identify a misconception or two that you wish people would understand that this is a misconception about women's health, about reproductive health, what would it be?
Oh, um, you gotta like prep me with these
I
questions.
know I forgot. I'm sorry.
That's okay.
Sometimes I remember to
On the
include it in
fly,
the
on the
email.
fly. Um, I think that we need to understand and trust women more to know what they need. And we need to be able to give people options and know that they know themselves best, and trust that they will make the decisions that are best for them, instead of these kind of like judgier attitudes, or why would you do this and why would you do that, and just like have a little bit more of like a laissez-faire attitude of, yeah, great. Good for you. Glad you picked what you wanted. And like I trust you to know your own life and know your own needs and make decisions that are good for you. And I think if all of us embrace that a little bit more, I think doctor-patient relationships would be better. I think consumption of social media would be healthier from the consumer perspective. And I don't know. I just think that we need to have faith in people that we can all decide for ourselves. So,
I love it. I
yeah.
love it. Let's leave it at that. I think that's amazing.
Okay.
Obviously, clearly the menopause conversation is going to be expanded at another time. I'm already
So,
formulating the
yeah.
questions and but really phenomenal. Thank you so much for spending some time with me this evening. I know that this is a powerful conversation and thanks for
Yeah.
allowing us to have it.
Thanks so much for having me.